Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program has a different healthcare professional on it each week where we talk about issues that might be relevant for you or your family members. I've got a great guest on my show today, so I hope you'll stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Jimmy Cabrera. He's a new position here at KRMC. Thanks for being on the show, Jimmy.
Thank you for having me.
So tell me again, what's your title?
My title is Respiratory Care Practitioner.
Okay, and that's a brand new position here at KRMC.
Yes, the position is actually DME Supervisor.
Okay.
And DME stands for Durable Medical Equipment.
Okay, so that means hard stuff you can
Yes.
touch, like a CPAP machine.
Yes, all home therapy side.
Okay, very
Yes.
good. Well, we're going to learn more about that, but first I'd like to learn a little bit more about you.
Okay.
So you and your wife just moved here recently.
Yes, August 1st of last year.
Very good. Well, welcome to Kingman. We're
you.
excited to have you. And you said your wife is a respiratory therapist
Yes,
as well?
yes.
So how did you meet?
You met in school.
Very
So.
good. And you're newlyweds?
Yes.
Like less than a year or
No,
close to a year?
No, made over a year.
Oh, just over
Yes.
a year. Okay, very
Yes.
good. Well, so where were you before Kingman?
We were in Las Vegas, Nevada.
Oh, okay, so not too far away.
No, not too far
Just
away.
down the road.
Yes.
Do you have family in Vegas?
Yes, both, our immediate family on both our sides are over there.
Oh, okay. So is that
Yes.
where you were born and raised, or?
No, we're actually from Hawaii.
Oh, you are?
Okay,
I was
yes.
going to ask you that. I lived in Hawaii for 6 years. One of my guests on the previous show that we had was from Hawaii, too. She spent 27 years in Hawaii and ended up in Kingman, too. Now, how about that? There's quite a few of us. Well, I think there's a lot of folks of Hawaiian descent who are in Vegas as well.
Yes.
As I recall, when I lived there, a lot of them were moving to Las Vegas. Just get away from all the tourists. Too many tourists in Hawaii, so they moved to Las Vegas. I don't know. Anyway, so you and your wife met at school, and before that, what other kind of training did you have?
Actually, before that, I was in the military for 8 years. And when I was in the military, I got my degree from Embry-Riddle.
Okay.
And then before I went to the military, I actually got my culinary degree from community college.
Lucky wife. Do you cook for her?
Actually, she cooks for me all the time.
Oh, really?
Because I'm always here working, so.
I know my husband is a great cook too, and he does the majority of the cooking in our house. We have this great arrangement. He cooks, I clean. It works out well. He doesn't like my Minnesota pot roast. Anyway, so did you actually get to use that culinary degree for a while? Did you cook professionally?
Yes. Well, as soon as I got the degree, then I went straight into the military. So I didn't.
Oh.
But I was cooking professionally before that, though.
Okay.
So I started cooking when I was 15 years old, and then went to the military when I was 20.
Okay,
Yeah.
very good. So what island were you on in Hawaii?
Oahu.
Oahu. Yeah, that's where I live too, but most of them live there. So you're in Kingman, and you're working in the durable medical goods, right?
Yes.
Did I say that right? DMG?
DME.
E.
Yes.
Equipment, not goods. Okay, very good. So what kind of equipment is involved with that?
Well, right now we're focusing more on the sleep apnea side.
Okay.
Okay, so we're doing a lot of CPAP, BiPAPs, and as far as sleep apnea therapy, and eventually we'd like to get certified in oxygen therapy, and then hopefully keep going on from there.
Okay. So like with the CPAP, so someone would come into the sleep lab, have that sleep diagnostic done,
Yes.
and then determine they do have sleep apnea and need a CPAP machine, so then you would see them and help get them fitted? Is
Yes.
that how it works?
Yeah, so the doctor would look at it, diagnose it, and tell me what type of machine would work for them, CPAP, BiPAP, or there's also like auto-titrating machines, which the patient will need a variable pressure,
Okay.
or there'll be another machine called the ASV, to where the patient might need a variable pressure as well as a backup rate, so where the patient's going to need so many breaths per minute.
Okay. Now, you also mentioned BPAP, and I have to admit, I've heard of CPAP. What's a BPAP?
Oh, BiPAP?
Or BiPAP.
Yes. BiPAP is actually it's actually just 2 levels of therapy.
Okay.
So now not only are you inhaling at a higher level, but when you exhale, it drops down to a lower level.
And the machine just monitors that type of thing? Is that?
Yes.
Okay.
Yeah. That's the good thing about these machines. They're getting a lot smarter, so they can feel when you're blowing out, and as soon as they feel that little pressure, then they'll start to decrease on you.
Oh, that's cool. Now, I shared with you before the show, I have a CPAP. I've had it for 5 or 6 years now. I think I've been sleeping with it. My husband sleeps much better. No, he didn't like being woke up in the middle of the night when I quit breathing. For some reason, that bothered him. So, but there's a lot of different types.
Yes.
And how does a person know what kind of machine to choose?
Well, as far as the machine goes, it depends on what type of sleep apnea you have. And of course, once the doctor reads a sleep study, then he'll let me know what he wants to put you on.
Okay.
And usually, the troubleshooting part comes down to the mask, the interface, because since everyone's face is different,
Right.
you know, like the same mask won't work for everyone.
Sure, and some
So,
people are more
yeah.
touchy about having things on their face than
Yes.
others.
Yes, or some people might have some type of facial deformity of some kind, so where
Or
we have to work with it.
sensitivity,
Yes.
maybe. So there's
Yes.
lots of options. I was looking here on this little head in front of us. He's got a pretty, that's a full face. It goes
Yes.
across the nose and mouth. And then I have the one I have is just the nose one. So go ahead and tell us about what you've got here, because educate me.
Yes, well, like you were saying, that this is a full face mask, and this one is Respironics. They're one of their newer masks, because what this one has, this one's made to float on your face, and there's no support up here for the head,
Oh,
forehead.
yeah, you're right. It is.
But
Okay.
so I've noticed that I've had a lot of luck with this mask right here, especially on people with higher pressures, because the main thing as far as CPAP therapy is you're going to get leakage no matter what.
Right.
You know, but you might get a little leakage here and there, but the most important thing is leaking in the eyes. And I find that this mask right here helps with a lot of that leaking.
I mean, as far as so it doesn't blow up around your eyes,
Yes.
which would
Yeah.
wake you up.
Yeah, and dry out your eyes and give
Uh-huh.
you vision problems. We don't want that to happen.
Sure.
And of course, like right here, another mask from Respironics. This is a nasal mask, and this is another mask that I find works really well with a lot of people.
It just goes on the nose.
Yes, there's straps with it also.
Uh-huh.
I took them off just for the
Sure,
demonstration.
make it easier.
And the masks that they're coming out with now, they're coming out with a lot better masks, because these masks are made to actually just stay on your face. So, I don't know if you can see this, but this one has an accordion styling.
Right?
So if you move a lot, it'll try to move with you.
Oh, versus pulling away from your face.
Yes.
Until I've had some experience with this.
And of course, there's the
pillow. That's what I
pillows.
have. Yeah.
Yes. So we do have a lot of success with the pillows. People seem to like it because it's very small, and there's not much in your face. So, but the one thing about the pillows though, is that depending on how your pressure is, you might not like it, because it can really dry you out, give you nosebleeds, you know. And
Haven't had that yet, thank goodness. Okay.
so, but yeah, there is always the option of the pillows. These are the three major masks, or the three major styles of masks. There's a couple more styles, you know, like nasal prongs and style masks like that. And there's CPAP Pro, which is a strapless mask, where it's in a dental appliance that just goes into your nose.
Oh.
Yeah. But the one thing about masks is that they're also creating a for her line.
Oh.
Okay, so that's the good thing about these mask makers, is that you know, they're coming to realize that these straps are way too big for women's heads.
Right.
So the only difference between these masks and the regular mask is just the straps are a little smaller, and of course they're pink, just
Oh, and then
show for her. That's the only main difference.
Okay. That's interesting.
Yeah.
I don't know, maybe my husband would like the pink better because he's the one that has to look at it. I call it my snuffleupagus, you know, because I got But it really, as we were saying before the show, I mean, I sleep so much better now since I did my sleep study and then got my CPAP, and it goes everywhere.
Okay.
I've tried a couple of times if we're just going away for one night, you know, I'll go, oh, I can get by without it for one night. No, I always feel it, you know, I feel so much better when I'm getting a full night's sleep,
Oh, good.
obviously. So yeah, it's a good thing. So now there's a couple of different machines that go along with it. We talked about the headpieces, but
Yes.
they connect to something.
Yes.
Obviously.
Yes,
So you've
and-
got some samples to show us here too.
Yes, this is the one style of machine. It's a Respironics machine. This is actually a CPAP, and of course, with Respironics, and so also with ResMed, they're making it so that all their machines kind of look the same to make it more user friendly.
Okay.
So whether it's a BiPAP or a VPAP or ASV machine, whatever it is you have, they're pretty much all going to look the same.
Oh, okay.
Okay. But one of the biggest improvements with the CPAP machines is the humidifier, as well as the wireless modem. So the wireless modem is really great, because especially for people that live a far distance like you do.
Right.
If your doctor wanted me to change your pressures of some kind, or even download a report, I can just go on a computer and just connect directly to your.
Really?
Yeah,
all you hook up to my machine. I don't
Yes.
have to bring my little card in with me to my appointments.
No, the only thing is you have to have a Wi-Fi connection.
Oh,
so I
yeah,
can.
that wouldn't work for me right now, but maybe someday.
Okay. This is really great for commercial drivers, because a lot.
Oh,
Yeah.
sure, when they're on the road a lot.
Yeah, because especially now they're cracking down on commercial drivers.
Right, they have to
with-
make sure they've slept
Yes.
for so many hours.
Yes, so this works really great for them, and also people with disabilities that can't leave the house.
Oh, good point. I hadn't thought about that one, but that does make a lot of sense. So that's pretty cool. I didn't even realize that they were doing stuff like that.
Yes.
That's very cool. And you can actually change the adjustment
Yes.
by that too. Interesting. Okay, so what else have you got in your little bag of tricks there?
The other one is it's also another CPAP machine, but this is the other kind.
This is nice too, the travel bags. I like
Yes.
that because I can put it right in my carry-on and bring it on the plane with me so it doesn't get messed up.
And this is a ResMed machine. This one doesn't have the humidifier hooked up, but
Okay.
normally it would have a humidifier right next to it.
Okay.
And the direction ResMed took was to make it more personable. Like they have a contract with skinit.com, and you can put your family's photo on here if you want. So that's the one thing about CPAPs. You know, there are all these improvements.
Right, right.
You know, they're just trying to
They've
make
come
it.
a long ways from
Yeah.
even my first one just 5 or 6 years ago, however long it was, and it's gotten smaller, more
Yes.
compact.
Yes.
My first one was pretty big.
That's pretty much everything inside here is pretty much the same. Only thing is cosmetics, and of course little comfort features here and there. You know.
And then, of course, you have the hose that goes from there to your mask that connects
Yes.
with your string. Okay, very good. Well, we're going to take a quick break, and then we'll get back and we can talk a little bit more about, you know, the sleep study and how the doctor determines what you need, and we'll go from there. Okay?
All right.
Great. Well, stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Jimmy Cabrera, and Jimmy's with our sleep area. Well, do you actually work in the sleep lab or separate?
Yes, well actually now that I'm there, like I actually work inside the sleep lab.
Oh,
I have my
okay.
own little office, you know, so but it's actually now that I'm there, it's a sleep disorder center, I guess. It's
Right.
always been a sleep disorder center, but they just got so used to calling it the sleep lab because that was the only thing there.
Right, right, yeah. So
So-
now it's more of a center because we
Yes.
actually have the equipment as well, which is pretty nice because now when a person comes in to have their sleep study done, then, and we've had, Mark has been on the show in the past and talked about having your sleep study done, but now they actually have the equipment so a person can see almost, well, that night, I mean, not that they'd get their
Yes.
equipment that night, but they could see what it is that they might be using
Yes,
in the
exactly.
future and how that's going to help. So then, I know you mentioned earlier in the show, then the doctor looks at the report after
Yes.
they've had the sleep study done and kind of determines what level of air they're going to need. And then, do you then help the patient decide which machine is going to work best for them? How does that work?
Well, no, actually the doctor will also say what he wants to give them, depending on what type of apnea he finds. If he finds it's obstructive, central, or mixed,
Okay.
then he'll actually decide on a certain type of machine.
Oh, okay. So each machine kind of has its specialty,
Yes.
if you would? Okay. So I didn't even realize that there was different types of sleep apnea. So let's talk about what the different types are. Now, you said obstructive. Is that the
Yes.
one where you quit breathing during the night?
Yes, well, all of them you quit breathing during the night, but obstructive is the most common one. And with obstructive, your muscles relax and they start to close off your airways. Your airways will actually
like-
narrow.
Where your whatever that thing is in the back of your throat blocks your passages.
Yes,
Okay.
it's your soft palate and everything.
Right.
So like the way it's rated, there's two types of things they're looking for. They're called AHI, apnea-hypopnea index.
Okay.
So for the apnea parts where your breathing totally stops, but then hypopnea is when your breathing slows down. So what they do is they look at that, look at severity, and then they see what type of machine they can put you on.
Oh, okay. And then from that, but then it's more of a personal preference as far as the facial part of it,
Yes,
right?
yes.
Depending on what they want to or can deal with on their face,
Yes.
type of thing. Okay. Now I know we talked about the sleep studies, and there's the what do they call it when the person falls asleep during the day?
Oh, narcolepsy?
Narcolepsy. Okay, so those are more side effects of sleep apnea, right?
Well, narcolepsy is it's something that the doctor actually has to order for a test.
Oh, okay.
Okay. So, as far as narcolepsy goes, like sleep apnea contributes to most of the daytime sleepiness. Whether it's narcolepsy or not, we're not really sure. That's why they, every time Mark does a sleep study for narcolepsy and MSLT, pretty much we all have to get out of there because he needs total quiet.
Oh.
Yes. So it's actually a separate test.
Oh, I didn't. But it's during the day when a person comes in for that?
Yes.
Oh.
Yes.
Okay. And what do we test that's different?
I'm not really sure what Mark tests for, but I believe that he just looks for something different.
Okay.
I never really got too in depth with him on it though.
I was just curious because
Yeah.
I always thought that narcolepsy was just like a really severe case of sleep apnea, and you fall asleep when you're, I know there were people I've known in the past that could do that. They'd be standing there and fall asleep while you're talking to them. And they're like, how do you do that? Anyway, so you talked about eventually we're looking at broadening our services into oxygen.
Hopefully one day, like
Okay.
right now we're actually working on our Medicare accreditation.
Okay.
And once we pass that, then we're going to be looking into moving forward.
Okay.
And especially, well, Tony was talking to us about maybe once DME starts getting bigger and bigger, hopefully we can get our own storefront.
Oh.
And then if we get our own storefront, then hopefully, be able to grow even larger. and then
Okay. So now that's the oxygen thing reminds me of like if a person's on oxygen, like has COPD or something like that, and they have sleep apnea, do the machines hook up to your oxygen somehow? So you do both, or what do you do when?
Yes. What we do is we can actually bleed into oxygen.
Okay.
But whether a person needs oxygen with the CPAP therapy or BiPAP therapy, whatever they're on, that's up to the doctor.
Okay.
Okay. Because just because they're on oxygen throughout the day doesn't mean they might need it at night.
Or sometimes maybe even the opposite though, isn't it
Yes.
too? Because when you're sleeping, if you're not breathing right, then you're not getting enough oxygen, and that's when the CPAP comes in, right? Because it's
Yes.
blowing the air into your nose and helping you get that oxygen going. You can tell I speak a lot from experience. So what other things do you think there is about CPAP machines that people don't know about? Is there other parts or that?
I find a lot is the care and maintenance of the machine.
Oh.
Yeah, like I'm not sure if it's just the way they're educated or what it is, because a lot of times like I get their machine, it's very dirty, and of course the dirtier the machine, the more sick you get.
I suppose because it's then actually blowing dirty air in.
Yes.
If you're not keeping the filter cleaned. And
Yes, and especially with the humidifier. People aren't cleaning it out. So of course it causes them to get respiratory infections, get mixing sick. So that's why I find the most common thing with a lot of patients is just the maintenance on the machine.
Okay. So you can teach them about that. So you're in education as well.
Yes. We actually have a courtesy check here, where it doesn't matter who you are or who you're with, what type of insurance you have. Bring your machine in. We'll perform a free courtesy check. We'll bench test your machine. We'll check all your equipment, let you know what we find.
Oh,
okay. And
I didn't know that.
Yeah, and it's all free of charge. And of course, if we find something wrong with your machine, we'll let you know. And we won't. If I find the settings that are off a little bit as compared to your prescription, I'll let you know, and it's up to you what you want to do with it.
Oh, that's good to know.
Yeah, because it's still your property, so
Right.
I'm not allowed to actually go in there and change the settings without your permission.
Right, right.
So-
But that's nice to know. I didn't even know that we had that resource. I'll have to
Yes.
call you.
Of course, of course.
What's your phone number?
Area code 928
Uh-huh.
263 3911.
3911. So if people have questions about the equipment,
Yes.
or if they'd like to bring their equipment in and have you look at it and check it out, they can call that number.
Yes.
Very good. And with the other equipment and stuff, like I said, as we're moving forward and broadening services, it'll be good for people to be aware that we have those options for them.
Yes.
So that's pretty cool. Now, when you went to school to be is it a respiratory therapist?
Yes, ma'am.
Okay. So, and then you just kind of took that and went into the sleep side of it.
Yes. Yes. Yeah, I
Okay.
kind of got thrown into it. When I got retired from the military, they're actually the ones that kind of pushed me into this path.
Oh.
And then as part of my rehabilitation, I had to work for the VA. And then in the VA, I was doing DME as well as pulmonary lab. and home
Okay.
oxygen therapy, and that's how I got my start in it. And it worked out great because when I got out of school, you know, I had a secure job lined up.
Right.
So,
Right. That works good.
yeah.
And then, but then you decided to come to Kingman
Yes.
instead. Well, it's nice because you're not too far. You mentioned your family's in Las Vegas, so that's good. They're not too far away. You can still get up and visit them, but far enough away that you don't have to worry about them just dropping in on you, right?
Yeah.
I used to have a mother that lived way too close. So this is good. So what kind of things do you and your wife enjoy doing outside of work when you're not working?
You know, we're pretty boring. We do a lot of Redbox nights.
Oh, okay.
Yeah.
Very lots of movies.
Yes.
Yeah.
So like when she's not working, we both go hit the wellness center.
Yes.
You know, like exercise a little bit. But
Good.
on the days that you know that we have spare time, a lot of times we just spend it on the couch with the dogs.
Okay. Oh, you have dogs.
Yes.
How many?
We have 2 Maltese.
Oh, very nice.
Yes.
Very good. Well, have you been up to the Wallapies and checked that out yet?
We've actually drove through there.
Uh-huh.
We got up to the campsite, you know, drove around a
Okay.
little bit and came on the back. It was just too cold to actually go
Oh,
out.
yeah. Yeah, especially when you're from Hawaii. Now, is your wife from Hawaii, too?
Yes.
Oh, I didn't. But you met in school.
Yes.
You
here
didn't meet
in
there.
Las Vegas.
Yeah. How funny is that? Small world we live in, right? Was she on Oahu, too?
Yes.
Yeah, see, and you had to come all the way to Las Vegas to meet each
I
other.
know.
How's that? That's pretty funny. Well, there's lots of fun things to do if you like the outdoors, of course, here, and you haven't really had a summer yet, so you've just had and it's been a very mild winter, I have to tell you. I mean, it's a bit of a shock probably when you've gone from Hawaii to Vegas, but this has been a pretty mild winter. It can get colder, but I tell people that what's nice with the Wallapies, you know, you can just drive up there, play in the snow, and then come back down and be out of it. That's my idea of a perfect winter. So I'm sorry, I get sidetracked a lot of times, start talking about other things, but when we were talking about the equipment, and again, we gave that phone number out, but if people had, I mean, I guess, how do they know that they should have a sleep study done? How do you think people, I know my husband told me.
Yes. A lot of times it's the partner.
Okay.
You know, and there is what we call Epworth Sleepiness Scale. It's just a questionnaire asking you different questions. You know, ask if you wake up gasping for air at night, or do you wake up excessively tired? Do you wake up with headaches? You know, those types of questions. If you answer yes and you get a high percentage of it, you know, with yeses, then your doctor might recommend a sleep study.
Okay. So is that normally, can any doctor refer?
Yes.
It's, okay.
Yes.
So it's not just Dr. Matheny or Wynn, our pulmonologist, but
No.
your primary care physician could give the referral as well.
Yes, but as far as reading the results, it's going to be like more or less like Dr. Matheny, because it'd have to be a doctor with a sleep board certification.
Sure, that has
Yeah.
that specialty, that
Yes.
knows what he's looking at. Obviously, not everyone can do that. And to get a sleep study done, I know you have to have that referral. And then with the equipment, most of that, it's covered by insurance,
Yes.
right? So if your
Yes.
insurance covers your sleep study, it's more likely going to cover your CPAP as well.
Yes, but the only thing is that we're not doing Medicare yet, but we are working towards it. And
Okay.
from what I understand is that the one insurance that we're not going to take is Medicaid, because I guess they have a what is that called?
Like a deductible or something?
No,
maybe?
not a deductible. It's they have a contract with another company.
Oh, okay.
Yes.
Right.
So-
And we don't want to do that. So.
Yeah.
Okay, very good.
Yeah.
Well, Jimmy, it was great having you on the show. Thank you. Every time I do the show, I learn something new myself. I hope you all enjoyed the program today, and you'll join us again next week when we'll have another exciting guest.